In the past, when I've had these issues, I had to seek regular doctors, and they always wanted to cut or operate or do some kind of radical procedure on me. And when I wouldn't allow it, then that's when they would tell me that you'll be dead by the time you're 50, and you'll just have a slow, miserable death, because what we're trying to do is ease your pain and give you a better quality of life, which basically some of the things were scary. One of the procedures that they wanted to do that I declined was to put a balloon in my uterus, fill it with scalding water to burn it and cauterize it to stop the bleeding, and then I wouldn't get a menstrual cycle for several months as it was healing. And then after that, they would see what the outcome would be, because I guess they've had positive outcomes for other people. But to me, it just was scary, and I didn't want to do it. So I opted out for hormone therapy, which just caused me all kinds of system malfunctions in my whole body and my brain. So that's why when I have something go wrong in my body, I come to Dr. Jodie, and I trust what he's going to do, because it's not invasive, and none of the rest of my systems or health is compromised for the treatments or the procedures that we go through to bring my health back up to a great baseline that gives me the best health I've ever had. Every time Dr. Jodie finds out about my health history, and I'll share something with him, and he'll be like, "Why didn't you tell me about that?" And I'll be like, "I know I told it to you, or maybe I forgot because there were so many other pressing issues, but when I came to you, I was so sick, so ill, with no hope, and you had said, you have 30 major things wrong with you, but we're going to address 5. And I said, and that's what we've done. I told him, that's what we've done for the last 7 years, is we've addressed those 5. And I've had a great life since. But every once in a while, one of these 30 things pops up, and we have to focus on it. Like that's why at the hospital, because of my history with the birth control pill and stroke and other issues that I've had, they didn't want to treat me at the hospital, even though Dr. Jodie had said, tell them to whatever it takes to get the bleeding to stop. And they were like, well, with your history, there's nothing we can do. So in their minds, it was hopeless. But with my back issues, I had back surgery when I was 13, and I've had chronic pain, and they've wanted to do several other surgeries too, like shoot epoxy into fractured vertebrae that I had. They thought I would be a candidate for that. And I declined that because epoxy doesn't sound natural. Put that in your body and get toxins from that. But I had 4 epidurals, and they did not work for me to the way that they should have. So they wanted to put a pump in my back, which they would put, drugs in like morphine and Percocet and things that when I felt pain, I could just naturally pump it in to my system. Well, I declined that because I had a elderly friend of mine who had that done. And the body gets used to these drugs. And when the drug would run out in her pump and she'd go back to the doctor, they would tell her, well, you just have to wait because you used it all up and your insurance won't cover it, or it's too soon. And then she was in agonizing pain. And I never wanted to become reliant on these types of drugs to the point where I felt like I was a drug addict and I needed pain relief, and there was no help. I just felt like dealing with what I had, especially since the epidurals already didn't help, and I did have nerve pain from that, from where they injected the injection site. So after 4 of those, I just became hopeless and stopped all that kind of stuff. The birth control pill, I mean, I don't know. I know that they give it to young women so that they can start their families when they want, but if you have any kind of female trouble, like any types of cancers or endometriosis or even fibroids, they do want to give you, they call it hormone therapy, but it is the birth control pill. And after I had my tubes in my ovary out when I was 29, they started me on hormone therapy. And so from 29 to 38, that is what they treated me with to keep my hormones balanced. And because of that, I had some strokes. And so because of my history with cancer and strokes, they would not treat me to make the bleeding stop. I think it probably just scared them, and so when I had gone for that heavy bleeding, it was, we can't help you, but at least we found out what was causing the bleeding. So from that point on, we have now been doing about 8 weeks of procedures, and my issues are cleaning up. My tumors have shrunk down to the size of almonds. They're flat, and Dr. Jolly said the flatness is a very good sign. So they're being absorbed, and the body's just getting rid of it. And it's all been natural, without any kind of surgery or drugs. Yes, I didn't meet Dr. Jolly till I was 42, and of course that all of the types of medical procedures and surgeries and diagnosis and issues that I had up to meeting Dr. Jolly were all handled by a regular medical doctor. I'd had surgery in Mexico, and I'd had surgery up here, and everybody did the best they could to make me comfortable, but my prognosis was never good. They were always just trying to slap a Band-Aid on it and send me out the door to make me as comfortable as possible. Yeah,
okay.
With my issues.
So that's when you had a stroke, was when you had cancer, and they gave you the...
Well, no, I had the stroke years after.
Oh, cancer, when you had it.
Yeah, the cancer, they didn't even know I had. They found it by accident. They just went in because I was having lots of lower abdominal pain and passing out from the pain, and they thought I had cysts. So they went in just to do exploratory surgery, and that's when they found the cancer. And they came out and they told my mother, your daughter has cancer, and we want to remove her tubes and one of her ovaries. And my mom was like, I don't think that's a good idea. You better wake her up and ask her. And they were like, we're not going to wake her up. And thank goodness they didn't, because I would have had gone under the knife again after healing up from all this. And the doctor just took him out and handled it like that, and then told me, and then I was like, fine. And then I was ordered to have 6 rounds of chemo, but I only did 3 because I became so ill, and I was a single parent with a 4-year-old, and I just couldn't do the rest of it. I just didn't have the support group in place where I could continue, and it was probably a good thing that I didn't get those other 3 rounds of poison in my body. That's how I've always felt, and even more so now, today, I feel that way. Yeah, coming to Dr. Jolly and the treatments that I get and complying with the guidelines he gives me, I have great health, and I always bounce back. I've not had an issue where I haven't bounced back yet. So thank you, Dr. Jolly and Dr. Tina.